I'm Dr. Wayne Larrabee.
And I'm Dr. Susan Currian.
We're here today partially to celebrate 35 years of the Larrabee Center. We've done so many innovative things over the years. We continue to innovate and be in the forefront. One of the things, though, that's been most important to us is teaching and spreading the word on various innovations that we've done. But the real important basic science of facial plastic surgery is anatomy. Anatomy is, if you're going to do a really good deep plane facelift or blepharoplasty, it's really based on understanding and knowing the anatomy. So when we first started, I wrote a book. It's called Surgical Anatomy of the Face. It was done with Kathy Mikulski, who was, she has a really interesting story. The book is good because of her illustrations mainly. She was a medical illustrating student at the University of Michigan. And as part of that, she took anatomy with the medical students. When she got in the class, she said, I'm as smart as these people, so why shouldn't I go to med school? So she went back to med school. But she maintained her skill. And when I was working at the University of Washington with her, she did the illustrations for our book here, which made it really a classic, a lot of great illustrations. But even earlier, we started thinking about how to best teach. And the easiest way to teach anatomy, obviously, is at the surgical table, but it's good to have a basic knowledge before that. So way back a long time ago, we started teaching anatomy courses for using cadavers in the university's labs. And we would start just, doing dissections and having the residents and fellows practice on procedures. And it worked out great. But later we formalized it and started having lectures and a more organized plan. We basically wrote a manual that's used around the country now for teaching those things. Dr. Currian's now taken that over. What do you think about the teaching labs?
Oh, it's wonderful. So I agree with you. I think that having a basis in anatomic knowledge is indispensable towards being a surgeon. It's been my honor and privilege to help with the University of Washington course that you helped originate for the past couple of years now. And it's a wonderful kind of melting pot of multiple specialties at this point, which is great. So I've worked with general plastic surgeons, ENT or otolaryngology residents, dermatology residents even. It's been a wonderful opportunity to show the anatomy, show differences in technique, because no two surgeons really do things the same way, and really make sure the next generation of surgeons is ready for what they're signing up for.
One of the great things about this course is we've had any number of famous and excellent friends, surgeons. I mean, Gary Burgett, Craig Murakami, you name it, have come here and teach at our course. And I'm so happy that this legacy is going to go on with Susan teaching these courses into the future. So stay tuned.